The CDC is coming out with a positive prediction on the pandemic, projecting fewer cases and deaths in the coming weeks. The agency says weekly deaths could fall to 3,200 by April 10th. Dr. Marty Makary is a Fox News contributor and professor of health policy and management at Johns Hopkins School of Public Policy. I'm sorry, public health. Was it about a month ago that you wrote a Wall Street Journal op-ed and you got a whole bunch of criticism? Do you feel a little vindication this morning?
Well, look, I'm not looking to win an argument. I don't think those people are going to apologize when the numbers show that the model was correct. And it seems like you can only have models that predict things far worse than reality if you predict an accurate model. Some people say, look, the projection I said gave people a false sense of security. I think it actually encouraged people to do what they need to do until we get to that point, because hope is on the way, and I think the numbers are pointing that way.
Okay, so what are we seeing in these numbers here? Let's see. The cases dropping. This is the 7-day moving average from January 21 was 250,000. In March, down to 50,000. You think this has some to do with herd immunity and vaccines? Can you explain?
Yeah, first of all, herd immunity is significant slowing when fewer people are susceptible out there. It's not a hard cutoff, and in fact, it's been kicking in. We already have herd immunity, Dana, for the nation's 23 million healthcare workers. Most have been vaccinated, and some others who haven't already have natural immunity from prior infection. We're about a week or two away from herd immunity in America's nursing homes. Cases there are down 98%. 10 states have had days with 0 deaths. Now, what do you call that when a place has 0 deaths in a day? I call that herd immunity. We're going to see more herd immunity across the country in April and into May, and that's part of the difference in vaccination rates. But we're seeing some really good news, and I don't think we're going to extinguish this virus, as I wrote in that piece. We're going to see cases linger, but a debate's going to ensue. Who are those people? And those are going to be primarily young people who have asymptomatic and mild disease. They could linger through May and even early June.
And what do you think is that the next big argument, or what do you think that next big argument is?
Yeah, and there was an article in the New York Times this morning that conservatives tend to understate the risks and Democrats exaggerate the risks. And they did a survey showing that Democrats believe that about 20% of COVID patients are hospitalized. Not true. It's about 1%. And so what you're going to see is this argument when there's cases in May where some who want the pandemic to keep going are going to say that's a significant public health risk and it could surge again. But the truth is those are young asymptomatic cases, and they're not going to surge because there are fewer susceptible people out there. There's a lot of vaccinated and natural immunity from prior infection.
And actually, you still recommend that people delay their second dose?
That's right. We could save more lives if people delay the second dose. The UK is doing it. Get the second dose at 12 weeks. That's what I recommend.
All right. Dr. Marty Makary, always a pleasure to have you.